Welcome back. In this section, we're going to talk about determinants of airflow. So as we've just discussed, we've talked about how the pressure changes with the muscles contracting and relaxing make the thorax enlarge and expand and relax afterwards. And that causes a pressure change, which causes a passive flow of air into the thoracic cavity, into the lungs. But if you recall from when we talked about blood flow, there's more than just pressure change that affects flow. And so another very important component of airflow has to do with resistance. So as you can envision, if we have a tubular structure, for instance, the trachea, or any of the airways, and we increase the resistance by decreasing the diameter or the radius, this is going to slow the airflow. And obviously, the opposite would increase the airflow. So let's look at that just a little bit closer. So the first component of resistance occurs when we have bronchoconstriction. And this is because there's smooth muscle surrounding the airways. And so when that smooth muscle contracts, the lumen of that airway decreases in size. So if you're saying, wait a second, Dr. Powell, we already talked about cartilage, and the whole point of cartilage in the airways is to keep them open. So yes, that is true. When you have a bronchus or the trachea with the C-shaped rings of cartilage, the cartilage does prevent that decrease in lumen size. But as we move distally along those 19 subdivisions of the bronchial tree, what's happening is we're losing more and more cartilage. And so then the predominant influence becomes the smooth muscle. And smooth muscle is going to contract to decrease the lumen size. So what causes the contraction? Okay, well, unlike blood vessels, where sympathetic nervous system causes smooth muscle and blood vessels to contract, sympathetic nervous system causes smooth muscle and airways to expand, which is really good because fight or flight, we want our airways to expand so we can breathe more. So if sympathetic causes airway bronchodilation, then it means that parasympathetic or acetylcholine cholinergic receptors are responsible for bronchoconstriction. Now, other things that can trigger bronchoconstriction include just going out in cold air or histamine, chemical irritants, for instance, from local fires, having the soot. And in fact, severe forms of bronchoconstriction can be seen in some diseases. For instance, when people are suffering from a severe allergy reaction known as anaphylaxis, and in people who have asthma. There are many different triggers for asthma, so each individual person's trigger for bronchoconstriction can be slightly different. Now, in addition to bronchoconstriction increasing the resistance, something else that increases the resistance is the change in compliance. So compliance, as you recall, had to do with the ease of expansion. When we were talking about blood vessels with their elasticity, they were expanding. And so what we're talking about for compliance in the lung has nothing to do with elastic fibers in blood vessels, but it has to do with some elastic fibers in the lung, okay? And what compliance is the same thing. It's the change in volume relative to any pressure change. And so you can see in the graphs 3 different curves for compliance. When compliance is low, it takes much more pressure to increase the volume. But when there's high compliance, a very minor increase in pressure will greatly increase the volume. Now, another thing to keep in mind when talking about compliance is even though the chest muscle walls may expand normally, the lungs inside may not, and that would be due to chronic lung diseases where we have scar tissue. And so this is very commonly seen in a disease called pulmonary fibrosis, where the name, as you expect, it means there's fibrosis, there's fibrocytes laying down, non-elastic fibers inside the lung. And this is a very well recognized sequela of many patients with COVID-19 right now. So the incidence of scar tissue in the lung is greatly increasing in the year 2020 and probably next year as well. Oftentimes, this is a permanent sequela, so it remains to be seen what will happen. Lastly, don't forget the effects of surfactant. So normally we don't talk much about surfactant because we realize that adults have surfactant as opposed to those preemie children. However, there are some diseases that affect the surfactant, but I'm not going to talk about that. So I hope you have enjoyed this very short section, and I will see you again soon when we move on to gas exchange. Thank you so much for all your hard work in this class.